Hi, I'm Shannon Green, and today we're going to talk about GBS setbacks. We're going to talk about falls, relapses, what else we got? Disability, stress. These are some of the topics that we are going to discuss today regarding GBS setbacks. This is where you follow me on Facebook at Chronic Pain Austin. So I do a lot of videos about life hacks on wellness. This video is about the Guillain-Barre recovery. So we're going to call Guillain-Barre GBS because it's really hard to say. It's actually pronounced Guillain-Barre. It's French. So today we're going to discuss the setbacks. I get a lot of questions and emails about this. The first one is falls. Having falls several years after having GBS actually is pretty common. I've researched it a lot and have talked to hundreds of people that have GBS or CDIP, and falls is very common. I will go over some things that I think are very helpful to avoid the falls. I've had 7 or 8 falls in the first 3 years after getting GBS back in March of 2014. And most of them are pretty bad falls. They would set me back. I would advance to a cane, and then I'd have to go back to a walker or wheelchair. So it's been 3.5 years, and for the last 2 months, I've been able to walk without a cane, so no walking assistance. So I'm ecstatic about that. I attribute a lot of that to my physical therapist and doing the physical therapy exercises every day, even when it hurts and you don't feel good. The more you move, the better you're going to feel. So that's my probably number one tip. Is the more you move, the better you're going to feel. Your second tip is stay positive. I know it's hard when you're hurting so bad, but trying to stay positive, finding support groups, counselors, meditation, adult coloring books, puzzles, whatever your thing is that can help you unwind and really de-stress. Because the more stressed and anxious we are, the worse our pain is going to be. So it's very important to try to reduce your stress levels and try to come up with a daily schedule, whether it's prayer, meditation, whatever it is that works for you that can help you de-stress every day. The second thing I want to talk about is relapses. Several neurologists have told me that you can only get Guillain-Barre once in your life. If you have chronic episodes after that first onset, it's considered CIDP. So CIDP is the chronic form of Guillain-Barre. But what is confusing is many of us will have several episodes where we think we're having a relapse. Like I went back to the hospital probably a year or so after my first Guillain-Barre, and I said, I'm numb and tingling again. I'm having trouble walking. Am I having a relapse? Is this CDIP? What is going on? They never gave me a definite answer, but they did give me 5 days of IGIV, which is the donated plasma treatment. The other treatment is plasmapheresis. So I've heard great things about both of them. I've never had plasmapheresis. I've just had the IGIV. But what I really think now in the 3rd year after visiting neurologists, more psychiatrists, that they were saying my stress and anxiety and depression was so bad, it was making my physical symptoms worse, and it was kind of mimicking a relapse. I was numb, tingly, having trouble walking again. So they had put me on hydroxyzine, which is actually an antihistamine, but it helps with anxiety, and I take it every 4 hours, and that has really made a huge difference in my pain and anxiety level. Again, that's hydroxyzine. It's also called Vistaril. It's an old drug that's been around for a long time. It has minimal side effects, so I highly recommend that. So that's relapses. Okay, stress. I mentioned it a little bit, but the more stressed you are, the more pain you're going to have. The next topic I want to talk about real quick is disability. I've had many people say, how do you file after having Guillain-Barre? Is Guillain-Barre considered an actual disability per Social Security? So I'm going to answer those questions. It is not considered a disability on their chart of permanent long-term disabilities on the socialsecurity.gov website. In my case, I just got awarded after 3 years. Actually, it took a year actually to be awarded disability. Now my situation's a little bit different. I had diabetes, and numbness and neuropathy before getting Guillain-Barre. And I also have a lot of PTSD and depression and anxiety and a whole package of things. So I'm getting disability for both mental and physical conditions. But it is very, very hard, and you have to have doctors sign off. So the first place I would tell people to start is find at least one, preferably 2 or 3 doctors that will fill out your disability form. So that's your first step. So I'll do another video because it's a long and complicated process on filing disability in the US. I mentioned a little bit, I'll wrap up here. The best thing that I have found is, and it's pretty simple, it's not the expensive medications or supplements. This one's free. Vitamin D. Get 20 minutes of sunshine outside every day if you can. If you can't, take 5,000 units of vitamin D3. So it's on the bottle, will say 5,000 IU. Staying positive. So I do my meditation, my prayer, and my adult coloring books every day. Thirdly, get a physical therapist that has really good reviews. Now you can look on Yelp and all the other sites. Having a good physical therapist is absolutely crucial. And just keep moving. I spent the first 2 years in bed and on the couch too much, and that even made my muscle tone worse. So laying around actually makes the situation worse. And it's hard because it's hard to get out of bed some days. It hurt so bad before my feet even hit the floor. You kind of know what day you're going to have just the second you open your eyes before your feet hit the ground. So I wanted this to be a realistic video of what really to expect, because doctors, medical professionals, I mean, I didn't have any clue that I would be disabled at 42 years old. That this is my life and that I'm going to be in pain probably every day. Guillain-Barre is an autoimmune disease. So autoimmune means it's very unpredictable. So factors like stress, anxiety, also humidity. Humidity makes our pain levels worse. Any little thing that would not affect an average person can affect someone differently with GBS, and every GBS patient is different. So, you know, I don't want to sound negative and discourage people, but I really want people to have an honest, true picture of what to expect for themselves or their family members. I mean, it's been devastating for the whole family. My husband and son had to take over many responsibilities that I used to do that I can no longer do. So it can be really devastating for the family. So finding a good support group that the family can come to as well as the patient, I think is very, very beneficial. I will wrap it up now. I have other videos related to Guillain-Barre on this same YouTube site. And again, my Facebook is @Chronic Pain Austin. Thank you for watching.